Alright guys, so we spoke about the first generation and second generation H1 receptor antagonist. And we said that these drugs will basically work to prevent histamine from binding to what? H1 receptors. Okay? And in this now, we said that the difference between first generation and second generation H1 receptor is simply because the first generation H1 receptor antagonists were formed in 1942, while the second generation H1 receptor antagonists were formed in the 1980s. All right, but these drugs were modified. Okay, so they have their own advantages and disadvantages. Right, we'll talk more of them when we go into the lecture. H1 receptor antagonists, once they bind to the histamine receptor, histamine will not have a receptor to bind to elicit its effect, so the effect will be what? Suppressed. So moving forward now, for the first generation H1 receptor antagonists, let's talk about them. They were available for use since 1942. These antihistamines work by what? Affecting histamine receptors in the brain and spinal cord. So for the first generation H1 receptors, yeah, they work other places, but they work more effectively in the central nervous system. I hope you guys are getting the advantages and the disadvantages now. Let's talk about the second H1 receptor antagonist. They were developed in the 1980s. These antihistamines cause less sleepiness and interact with fewer medications. They are able to reduce inflammation caused by allergies, and they are favored by their effectiveness and fewer side effects. So that's to tell you guys that H1 receptor have more side effects. They cause you to sleep. Okay. The only advantage of H1 first generation H1 receptor antagonist over the second generation is that the first generation H1 receptor antagonist they penetrate the central nervous system readily. Okay, so moving forward now, let's talk about the adverse effect. When you are treating a patient with either first generation H1 receptor antagonist or second generation H1 receptor antagonist, what are the things that you can be expected to see as a side effect? Okay, sedation. Sedation, as the patient can be having a feeling of sleeping, dizziness, all right, tinnitus, fatigue, the patient will be weak, blurring of vision, they will not be seeing well again, right? Tremors, shaky hands, nervousness, and insomnia. Insomnia will be what? Difficulty in sleeping. So you are weak, you are dizzy, but to sleep is a problem, okay? Uh, okay. So guys, that's it about the adverse effect caused by first and second generation H1 receptor antagonist drugs. All right, so that's it, and bye for now.